Welcome to Ask Dr. Geier Live, wherever you're watching. I hope you're making today your masterpiece. My name is Dr. David Geier, the aforementioned Dr. Geier. I am a triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Very, very excited to be here. This is that one time a week, the one place that I answer your questions, whether it's health and wellness, whether it's orthopedics, injuries, surgeries, rehab, recovery. That is what I'm there to do. Please remember that I cannot give you medical advice online. That is not allowed in the United States. So what I'm giving you is information and education only. You can take that information to your doctor and then make the decision that's best for you. You can listen to what your doctor has to say and then come here and I can try to translate for you. But I am not telling you what you do because I'm not your doctor. You're not my patient. If you'd like to see me as a patient in Charleston, South Carolina, the information is in the description below, and I can talk about that a little bit at the end. Couple things too, those of you on YouTube, please put your comments in the chat, not in the comments, or your questions, I should say, in the chat, not in the comments. I cannot see them in the comments because I'm not actually on YouTube right now. I use a service called Restream, or actually, Ecamm and Restream to send it out to YouTube and Twitter and Facebook, so I can't see it that way. If you're on Twitter, they're still having, or maybe it's mine, I don't know, but for some reason I can't see the questions that you put on Twitter. So if you want an answer right now, go over to YouTube and watch it there, enter those in the chat, or enter those in Twitter and I will get on there after the show at some point and answer them that way. Same rules apply though. It's not medical advice. I'm just giving you information and education. All right. And as always, I stay as long as there's questions. Some days that makes for a really long show, 20, 30 minutes. Some days that makes for a very short show, anywhere from 5 to 8 minutes. So we'll see how that goes today. All right, Elizabeth Crowley, how long does it take to feel improvement from Penicillin Polysulfate injections? Fantastic. So first of all, before I answer that question, Penicillin Polysulfate, I've done a few videos about that on my video channel, and so if you're not familiar with that, that is a treatment that is being investigated right now here in the United States for osteoarthritis. It's been FDA approved since I think the 1950s, for a long time, for a bladder condition called interstitial cystitis. Taken that way, it's given as a pill that you take every day, very high dose, has a ton of side effects. When you Google Penicillin Polysulfate, all of those side effects that you're going to see are for the oral form, not the way it's given for arthritis, which is as an injection. Now, it is not currently FDA approved in the United States for osteoarthritis, so it has to be used off-label. And I can tell you, just because I hear it from people that reach out to me, they really struggle to find physicians that will give it as a subcutaneous injection, meaning an injection you give yourself twice a week. There aren't many places that do that. Now, what I will tell you is that it does seem to be helpful for osteoarthritis. I have heard from people that are stockholders in the company that they are confident it will get FDA approval within the next 1 to 3 years for osteoarthritis. So that will be fairly exciting. It will still be as an injectable medication. So expect something similar to what happened with semaglutide, a peptide that had been on the market for a long time, or not on the market, but you could get it through compounding pharmacies and integrative medical practices for years, was approved as actually an FDA approved medication, I think last summer. Now you can get it at your CVS or Walgreens. It's just very expensive that way. But I expect it'll be the same type of thing as a subcutaneous injection, maybe an auto injector. We'll see how that goes. Now, as far as the relief, there's two things I want to say. First, I'll answer your question, which is, in my experience, it's somewhere between about 4 and 12 weeks before you see benefit. I've seen people get relief sooner than that, but that's not the norm. And then I've seen it be on the longer side. But almost everybody, I've really not seen many people at all not get any relief from it. You do get a little bit of bruising in about a third of the patients early on, bruising around the injection site that goes away. You can't give it to somebody on blood thinners like Coumadin or Eliquis, or at least you shouldn't. But here's the other thing I'm going to say about penicillin, and the company that makes it may disagree with this. This is just personal, what I've kind of figured out treating arthritis my whole career, and then really doing it in depth in what I call anti-aging orthopedics, using sort of integrative and lots of innovative treatments, is that penicillin is very helpful, but but I don't know that it's a game changer as a standalone treatment or a standalone medication. I feel like, yes, it can stop the inflammatory cytokines that break down cartilage. There's debate about how much it actually rebuilds cartilage. Maybe they'll have some data that shows that it does. I haven't necessarily seen that, but I hope it does. But maybe combining penicillin with treatments that do help rebuild cartilage, that do support and strengthen the tendons, ligaments, cartilage, muscle around the joint. And so as a combination of treatments, I feel like penicillin is actually very helpful. So I know it's a lot more than you just asked, but I don't get to talk about penicillin very much. That's my 2 cents of it, at least as of right now. Harsha, how to recover quickly from a ACL partial tear. All right, another one that I've got to set up, because that's a complicated question, in that there aren't many true partial tears of the ACL. Yes, if you get an MRI, the MRI report, the reading may say partial tear, meaning what the image looks like shows that a certain percentage of them are torn, but some of the fibers of that ACL, of that ligament, are still intact. Here's the thing. The ACL is like a rope, and if you can imagine a rope breaking, it doesn't like just fray part of it. It sort of explodes. The ends are all sort of frayed, and it's not torn in a straight line. There may be a little bit hanging on. Typically, it's not very much. Almost always that MRI report will say something to the effect of high-grade partial tear, and you know that that's way more than a partial tear, because there will be what's called a bone bruise in a specific location or a specific pattern of locations in the knee, and that tells you that even if there's certain fibers still hanging on of that ACL, the ligament itself is functionally disrupted. It's essentially a complete ACL tear. That is far, far, far more common than a partial tear where the ligament is still stable. I've probably seen that less than 10 times in my 18-year career, where it was a partial tear that didn't end up needing surgery. The vast majority of those partial tears are those high-grade partial tears that, again, when you test it physically, the knee gives way and you know that that ACL isn't doing something. So then in that case, you're talking about essentially a complete tear. Very likely surgery, very likely 9 to 12 months of rehab and recovery. If it is a true 10, 20% of the ligaments torn, but the vast majority of that ACL is tight, not stretched out, again, not common. If it's that, then 6 to 8 weeks maybe. That's a little hard to say, assuming there's no other damage. Again, I just would be highly skeptical of the diagnosis partial ACL tear, just from a long, long time and doing well over 1,000 of those surgeries. That's just my experience there. Shang Shi in Detroit, MRI, mild chondromalacia, 10 years after partial meniscectomy. My knee became, I'm not sure what that means. Stem cell therapy to help you avoid surgery. I do think there are various regenerative treatments, even now, that potentially can help cartilage regrow in a situation with chondromalacia. I didn't understand some of that question, so I may not be getting it. But in terms of rebuilding cartilage, yes, I do think we're getting there. I think it's not perfect now. I think there are things to try. Stem cells, especially in countries where you're allowed to culture the stem cells, I think could be a great option. I know that PRP can be a great option, especially when you get the platelet counts in the billions. I feel like can be really helpful. There are studies looking at exosomes. I know there's a number of different things people have talked about. Adipose-derived stem cells from fat, basically. So there's a number of things out there, and over the coming years, I think it's only going to get better and better and better as we get more and more funding in this, as we get more companies involved. There's just so many patients with arthritis. The market is potentially enormous, and not everybody wants surgery. And you have to remember, hip and knee replacements have done wonders for millions of people around the world, but depending on the studies you read, at least with knee replacements, up to 30% of patients are dissatisfied with their outcome, and that's up to a year later. That isn't good necessarily, and so if you're trying to avoid that surgery, regenerative options, I think, can be good for a lot of people. Are they perfect right now? By no means. And they're all still considered experimental or at best used off-label. So you have to kind of understand that going in. And nobody would be able to promise you that you're going to be good as new, no problems ever if you do it. But you can't promise that with a hip or knee replacement either. So I do think that there's a lot of things coming and things that are even out there now that can be very effective. Have there been any advances in hip replacement surgery from 8 years ago? So I am not a joint replacement surgeon. I did, you learn that in your orthopedic residency, and I did some in my fellowships, but then I did sports medicine, not joint replacements. But from a distance, what I'll tell you is essentially no. Yes, they keep working on improving the materials to make them last a little bit longer, and with certain types of joint replacements, they've gone to robotics to make the instrumentation and the cuts precise locations. With the rehab, there have been some advances in the rehab, but in the surgery itself, it is very similar to the way it was done 30 years ago. I think that's how it's going to go. It's just going to be little incremental improvements, but there's not really been anything game-changing. I haven't heard of anything coming that's game-changing. But again, I may not be the right person to ask because I'm not fellowship trained in joint replacement surgery. I'm not biased to that being the only surgery I do, and that's all I do all the time and all that kind of stuff. So for what that's worth, but it hasn't changed all that much. Priscilla, broke my femur 1 month ago. I'm sorry to hear that. Rod and 4 pins placed. How long for recovery? Active 81-year-old before. So femur fractures take a long time to heal, but the nice thing about it, if you treat it the way hers was, with a rod down the center of the bone, the great thing is that you're allowed to put weight on it immediately, or at least that day, the next day, something like that. Obviously it's painful, so it takes some time. You're using crutches with some of that weight bearing, but that actually helps the bone heal. In terms of how long until that bone's healed, and again, it would depend a little bit. At 81, was it a mid-shaft femur or was it up at the hip as well? That changes it a little bit. But the femoral shaft, the long cylindrical part of the femur, the thigh bone, about 4 months, but can be a little bit shorter, a little bit longer than that. Everybody's a little bit different. It's a long surgery, but people can do well with that actually. I don't know if that's D-lash. Tibia fracture not long ago, like 2 weeks ago. Intramedullary rod. That's funny. 2 straight people with that. ACL repair on the same leg, 2019. I don't know. Is it possible to recover in time? I missed in time to recover. Oh, football season starts in August, I think is what you're getting at. From a tibia fracture, the end of April. I again, not medical advice, but I will say probably not. Typically that's about 6 months, and I have had a number of tibia fractures from football, at least our football. Well, I've actually had it in soccer too, what a lot of people call football, and it's about 6 months to a year. The bone at the quickest heals in about 3 months, but they're still struggling to run and things like that. I think 6 months is probably the minimum I would ever tell a patient that I was working with. Let's see. Another one. How to recover quickly from an ACL tear. The big thing is get your strength back. Work with a physical therapist that really rehabs a lot of athletes, and especially a lot of athletes with an ACL tear. And there are growing to be more and more physical therapists that focus only on ACL recovery. If you can find one of those, that's fantastic, but it's a lot of getting the strength back. It's a lot about very early on getting the motion back, and then really work on testing those sport-specific motions, whatever it is you do, whether that's soccer or basketball, but being able to do those motions in a controlled environment on that basically reconstructed leg, and a physical therapist can help help steer somebody through that. Very, very hard to get back to a high level of function, a high level of activity without a really good physical therapist. That's one of the very rehab-dependent surgeries. The physical therapists are crucial. Meniscus transplant in advance to prevent it from getting worse. Somehow I missed the discussion of a meniscus right to prevent. The meniscal transplant, I can't give you advice, and even if I had MRIs and X-rays, I couldn't not legally be able to show you that or go over that anyway. Having said that, the indications for a meniscal transplant are if you've had enough of the meniscus taken out that there's basically none left, and you have no or very, very little arthritis changes anyway. And typically younger people, not overweight, normal weight bearing axis of the knee, or you have to do an osteotomy at the same time. Though there aren't as many people that are true indications for meniscal transplants as you would think. And so if you're one of those that almost all the meniscus has been taken out, the rest of your knee looks fairly good, and you're fairly young, not significantly heavy, then yes, it can be a good option. But that you just have to see if you fit into that category for sure. The Georgia, is good to see you. I don't know why I can't get these on and off the screen. Mary is commenting to Priscilla. I appreciate you guys interacting with each other. Sorry, they're really small on my screen, and so it's not till I click on it that I see what they are. And Georgia, I am appreciating. I love the fact that people just come even without questions. And again, I apologize. I don't know what your first name is, but D Lash, you are very welcome. All right, that looks like it's going to wrap it up. I will say, if you would like to come see me in Charleston, and I get more and more people, not just from the United States and all over the United States, but from other countries that come here to see me because I talk to them about things other than surgery, cortisone shots, and physical therapy. I am happy to do that. We're especially looking for people with knee, shoulder, hip, or low back pain that want to get significantly better in 30 days. We've put together these treatment protocols we're really excited about and seen really good results with. So if you're potentially interested in that, there's a link in the description below. Click that link. It goes to my website. Click the work with me. It'll take you to a contact page. Fill out that form, and that will get to me and my assistant, and we will talk to you about potentially how we can set up working together here in Charleston, South Carolina. Very, very excited if you're interested in that. If you're not, I certainly get it. It's a lot to come here, especially come here multiple times, but it is something that at least know that that's out there if you're kind of frustrated with the options you have wherever you're located. All right, I am going to turn you loose for the weekend. I hope you have an amazing, amazing first weekend of May, and I look forward to seeing you very, very soon on our next Ask Dr. Geier Live show. Have a great weekend.